Hello, everybody. My name is Dr. Z. I am a clinical psychologist specializing in transgender care. Welcome to my channel. If you're new to my channel, please make sure you do subscribe. That way you don't miss video coming from me. If you're a regular viewer that has not yet subscribed, I would very much appreciate if you do subscribe. This way, all of you are not only supporting and helping me and my content, but you're also helping so many others find these videos. And also, if you don't yet follow me on Instagram, the link is below. Please also let's connect on Instagram. That's where I personally show up the most. I'm there daily with tips, guidance, and advice for all of you. So I would love to connect with all of you on Instagram as well. Having said that, for today's video, I would love to share with all of you 5 most common gender dysphoria subtypes. Gender dysphoria, as a lot of you know, is a discomfort, it is a distress, it is a psychological turmoil so many of you experience when you don't feel alignment with your gender assigned at birth. Now, gender dysphoria, as we know it, is, in terms of discomfort, is in a way this common denominator that a lot of people are going to experience. But that common denominator then breaks down in numerous different subtypes. And today I'll be sharing 5 most common ones, but there are definitely more than these 5 subtypes. Understanding gender dysphoria subtypes is very instrumental to all of you because it is going to help you then be more informed on whether you have gender dysphoria stemming from, for example, gender identity root issue, or maybe it has more to do with your gender expression and your gender presentation, or maybe it has more to do with some other root causes. Gender dysphoria subtypes are also helpful to understand because they can help you make better decisions in regards to what your goals are, in regards to what gender affirming care you may want to implement in your personal life or not. So for that reason, talking about gender dysphoria subtypes is helpful. It's also going to help you pinpoint why you feel particular distress versus other people feeling some other forms of distress. Like I always say, gender dysphoria, the way it manifests, tends to be drastically and widely individualistic and different across each individual. There are absolutely no two people that experience gender dysphoria in exact the same way. And that's really, really important to keep in mind. So let's look at these 5 most common gender dysphoria subtypes. The first one, and the very, very common one that a lot of you are most likely watching this, experiencing as you watch it, is physical dysphoria. Physical dysphoria is when one is experiencing distress in relationship to primary or secondary sex characteristics, in relationship to physicality, in relationship to body, in relationships how you see yourself, in relationship how you relate to your body. Physical dysphoria is more subjective in a sense that what I mean by subjective is that it revolves around how you specifically feel about your primary and secondary sex characteristics in regards to how you specifically feel about your body. Physical dysphoria can also have intensity ranging from very intense to pretty moderate to pretty neutral, where people just feel like it's very, very small level of discomfort, whereas they may just feel a sense of neutrality. Physical dysphoria tends to present itself most of the times, I would say pretty much majority of the times, for individuals who have gender identity as a root issue and who also identify as trans-binary. Trans-binary is the term I use to describe individuals who see themselves as transgender, very, very close to the very binary end of a spectrum. The more trans-binary you see yourself, the more chances are you're going to feel physical dysphoria, because you are going to feel a stronger sense of disalignment with your primary and secondary sex characteristics. So physical dysphoria is the first one. It is the one that is very, very common. A lot of people feel it, and it will also range not only in intensity, but it will also range what specifically you feel in regards to which body part. For example, Some people may have physical dysphoria in regard to their upper body. Some people have more of it toward their lower body. Some people may have a combination of both. Physical dysphoria doesn't mean you have to feel discomfort with every single secondary and primary sex characteristics. For some people, it might, but for a lot of people, there is going to be a range. Like I said, it is very individualistic. It is very distinct to each one of the individuals. The second most common subtype after the physical dysphoria is social dysphoria. Social dysphoria is when social dysphoria is discomfort and distress you feel when how others relate to you, how others perceive you. Whereas physical is more, like I said, subjective in a sense of it's your relationship to your body specific. Social dysphoria is more external in a sense of it's now how other people see you. And social may have as much to do with your role, with your gender role, with your gender presentation. And it also socially can do how people perceive your gender cues, how people also perceive your secondary and primary sexual characteristics. It is how the world responds to you. It is how the world scans you, and based on our conditioned gender markers, it is how the world then quickly boxes you into particular gender categories. That tends to cause people who already feel lack of alignment, who already feel disaligned with their gender assigned, distress, because now socially you perceived as something you don't resonate to yourself, you don't see yourself with, and that increases distress. A lot of people who are transgender identified feel a combination of physical dysphoria, the first one subtype, and the second one social, very, very common. The interesting thing about social dysphoria is that in today's day and age, because we are now shifting and learning and exploring and expanding our understanding of gender and gender identities, a lot of younger generations, because they're being brought up in this environment, they're being brought up in this context where we are talking about gender issues, they start perceiving and they start relating and understanding their relationship to not only their gender identity, but also to their gender role and gender presentation and gender expression differently. So what's interesting is that we're seeing a whole generation of young individuals who may not feel physical dysphoria because they have a different understanding of gender concepts. Perhaps they have a better conceptualization that it's just a construct and it is us who gender our bodies, but our body parts don't know gender apart from socially imposed ideas of gender. As a result, some young individuals are starting to feel social dysphoria because they start to gender bend, they're starting to explore who they are, and they don't have physical dysphoria and they only have social dysphoria because the world still hasn't caught up with them. They're catching up with, I would say, conscious evolution of gender, because I really truly think that what's happening is conscious evolution of gender. So the youngsters are catching up, but the rest of the world has not yet. And as a result, the world is pushing up against their gender bending, and that gives them a lot of anxiety and distress. And then inevitably, a lot of youngsters start developing physical dysphoria and then get into gender affirming surgical care, which I think is really unfortunate, because the only reason why they're stepping into it, a lot of them are, is because of this world push back. And that's a phenomenon in itself. A lot of times people who want to eradicate gender diversity altogether, or who continue to stick to the binaries of gender in order to try to save the young generation, they don't understand that they're actually doing worse. They're actually infusing them with a lot of anxiety versus allowing them to socially modify, to socially find their gender expression and their gender presentation without stepping into any kind of surgical medical things. And not that surgical medical things are bad, but they're not also for everybody. So that's a social dysphoria, and that's the interesting phenomenon that is happening with social dysphoria in regards to younger population. The third most common subtype of gender dysphoria is going to be presentational dysphoria, and it's actually differs from social dysphoria. Social dysphoria, again, is how the world sees you and how the world perceives you. Presentational dysphoria is how you feel yourself, how you relate to yourself in regards to your presentation, to your gender role, to your gender expression. It has maybe a little bit lesser to do with the world, but it's more to do with discomfort you feel in regards how you're presenting, in regards to the way you're showing up in the world, and it does infuse you with dysphoria. Keep in mind, all of the 5 subtypes can and do oftentimes overlap. Presentation dysphoria and understanding presentational dysphoria is also important because oftentimes presentation dysphoria is something that a lot of younger individuals also going to struggle with, because it is going to have to do with sorry, I have like a fly flag at maths. Presentation dysphoria is going to have to do more with feeling yourself as a different gender role or gender expression, gender presentation. And while you are trying and aiming to present yourself in such a way, you're also struggling because there is lack of perception of that type of exploration, of the type of identity. The fourth common gender dysphoria subtype is sexual dysphoria. This is a big topic. This is a topic that often gets very inaccurately confused with Ray Blanchard after-gynephiliate theory, which I talked about on this channel. I have a long video about it. If you haven't seen it, check it out, where I present my critique points to the theory. When I say sexual dysphoria, I mean 2 things. On one hand, sexual dysphoria is feeling dysphoric discomfort, feelings that distress, particularly in instances of intimacy, particularly of instances of sexual openness, sexual vulnerability, any element of sexuality. So it's a discomfort that individuals feel in regards to their sexuality, in regards then to gender. And on the other hand, what I mean by sexual dysphoria is individuals who have sexual practices, sexual personal preferences, where by gender bending or being exposed to any kind of gender bending pornography or gender bending erotica, individuals who find it sexually appealing and desirable. As a result, they may engage in personal sexual activities, masturbation, for example, self-pleasure, and then the orgasm, what commonly today we call sexual fetish, right? And it essentially, for a lot of people, and I talked about it as well too, for a lot of people, essentially, it starts to develop as a sexual practice. But of course, in today's world, we, of course, condemn such sexual practices as taboo. People develop shame and guilt as a result of it, and then they get into a vicious cycle of questioning themselves. And then for a lot of people, it leads to a path where they start experiencing and developing gender dysphoria, in this case, sexual dysphoria, as a result of their sexual practice, right? So for a lot of people, for example, if sexual practice was normalized and it was not seen as taboo, people would not eventually go down the pathway of developing gender dysphoria. So that's what I mean by the second pathway of sexual dysphoria. And sexual dysphoria in of itself is a huge, huge topic. There's more than actually these 2 pathways that I just discussed, and I will eventually do a more in-depth video on it because it warrants a more in-depth video, but that's sexual dysphoria. And the final one, the fifth one, is linguistic dysphoria. Linguistic dysphoria is one that tends to manifest and presents primarily in non-binary folks, primarily individuals who identify as agender, individuals who identify as gender fluid, individuals who tend to succumb to language, especially pronouns other than binary pronouns. And linguistic dysphoria is when you are experiencing distress because you're existing in a world where there's really no language to describe and contextualize your experiences. And when the language presents itself, for example, such as pronouns as they, them, or ze, it is not being respected. It is not being met or validated or acknowledged by the wider public. Linguistic dysphoria is also a challenging one because, sadly, we're byproduct of binary history, and so anytime you open any form of literature, anytime you open a book, anytime you go on internet, you read a blog, you're constantly being bombarded by binary language. And for somebody who doesn't connect to that way of seeing themselves, especially their pronouns, it will increase gender dysphoria. It will lead to gender dysphoria. And that's what linguistic gender dysphoria is. Again, it is very, very common in non-binary individuals, very, very common in agender individuals, very common in individuals who, anybody really who doesn't resonate or connects to binary pronouns. And linguistic dysphoria can be really, really vicious, because if you go out there constantly and you being gendered with binary pronouns, that's like taking an invisible kick to your gut. And every time you get that invisible kick to your gut, you are accumulating the effects of it. And eventually, sadly, a lot of non-binary folks, and I'm using non-binary now as a huge umbrella term, non-binary folks start to then question validity of their identity, or they get to the point where they're so exhausted of constantly asserting themselves, that they then make decision, you know what, I'm just going to lean towards one binary or another versus just remaining where I'm at, because it's just too much. And that's a very unfortunate thing when it comes to linguistic dysphoria. So those are the 5 most common. Like I said, there are other gender dysphoria subtypes. These are the most common ones I see. Physical or social, absolutely, very, very common. Oftentimes, they are interlinked together. Presentational dysphoria, sexual dysphoria, and linguistic dysphoria. They're all very individualistic. They all may be present in individuals who have gender identity as a root cause issue. They all also can and do show up in individuals for whom gender identity is not a root cause, and when other factors may be at play. Again, like I always say, gender dysphoria is a very deeply misunderstood phenomenon. There's a lot there that we still need to explore and to learn. Comment below, let me know which one of this nagging you the most, which one of this do you struggle with the most. You may have combination, you may have all 5 of them. Very, very common to have a combination, or like I said, all 5 of them. Comment below, share, and I will see you all next time. Goodbye.